Woman, an in-depth exploration of the world of women today with Samantha Dean.
Good evening. Tonight's topic is drugs and how they affect today's youth. Our guests are Mr. Thomas Regent, Chief of Toxicology from the Erie County Laboratories, and Dr. James Creighton, Erie County Medical Examiner. Tom, when we were talking just a few minutes ago before the show, you mentioned something that was very startling to me personally, and I don't think very widely known. I'd like you to elaborate a little bit on it, if you would. You were talking about the different ways that one single shot of heroin can affect people.
Yes, and I would even go one step further and say that one single shot of perhaps any other drug besides heroin can and in fact has been lethal. It does not necessarily require an overdose amount of heroin or a heroin-quinine combination to produce death. This has happened in many cases, and I'm sure that many of our listeners, and probably most of our listeners, are not aware of this. The message that we will try to get across, at least in part, is the fact that massive amounts of drugs are not the sole cause of the fatalities and the tragedies that we see nationally today.
So one single shot of heroin or anything else can affect somebody fatally.
It can and has, yes.
Mm-hmm. Do you have any figures on the breakdown of girls versus boys that become addicted? Are girls more prone, boys more prone in the early ages?
In our business, if we can call it that, we certainly find a very startling statistic, and that is that the girls or women actually use a great deal, or a higher percentage of the girls use a great deal more drugs than members of the male sex. And this is, generally I'm talking about deliberate overdose, but not necessarily a suicide attempt as such. They are trying to evoke some sympathy from their boyfriend, their husband, their mother, their father, for some misunderstanding.
But do you think there are any specific sets of circumstances which lead girls to become more addicted, other than the sympathy thing?
To become more addicted, no, I can't think of any specific sets of circumstances
cultural patterns, perhaps?
that would cause this. Perhaps Dr. Creighton might care to comment at this point about that. It seems to me, at least, that there is a large number of female addicts.
Dr. Creighton, do you have any feelings on this, or any idea about which specific age group is most vulnerable to the attraction of drugs?
Well, I think your younger group, probably in the high school age, start in the high school age. I agree with Mr. Regent that there's more use early in probably girls, although I think that I'm not up on statistics as Mr. Regent is. I think my impression is that there's also a fair percentage of boys who are using drugs. Now I'm talking both, first of all, maybe at the high school level of the soft drugs, if you want to refer them to soft, as meaning the barbiturates and the uppers and the downers and the this type of drug, as opposed to the hard drug, say, let's limit it to heroin. The instance we find, of course, when we get into in the field I'm doing, is mostly we see them when they're dead. And this is a real tragedy. It's a pattern where you talk to the families, they've had problems, maybe they've had overdoses in the past. They've been helped by the families or helped by psychiatry. They're disturbed.
Do you think in a home where the mother takes amphetamine-based diet pills, the father takes tranquilizers to sleep, and both parents drink, do you think this pattern is more conducive to setting the tone for later addiction amongst the children?
Well, I think that the home environment, I think you have to look at the pattern of how children learn. I think they learn from parents at home. They learn from their peers. And with all due respects to television, they learn also from television.
If I can comment here, I would like to point out that interviewing children at the age of 11, 10, 9, sometimes 8, why did you shoot up heroin? They have been caught at it. We know that this is what they've got in their hands. Why did you do it? The usual answer that we get, my brother does it, or my sister, or my mother. Mm-hmm. Nobody has told them that this is harmful. They have witnessed it in their own home, and these people are apparently leading a good, normal life, and so they feel there is nothing wrong with it. Mm-hmm. In other words, we have to now point the finger somewhere along the line at the education process.
Peer groups being tremendously...
Peer groups being the educators in this case, and society apparently has failed or has not even tried.
Because everyone is always making statements about drugs. Parents say one thing, peer groups say something else, spot ads on television say something else, and even the President's Commission on Marijuana says, again, something quite different. It must be very confusing for the teenager. How should he sort out the information from the misinformation?
But what are we doing? We are looking too much at two groups of drugs. We're looking at heroin, we're looking at cop-outs, society dropouts. Nobody says don't use aspirin. They don't say don't take too much of California syrup of figs, for instance. Everywhere you turn around, drugs, heroin, LSD, drugs, heroin, LSD, so that we have steered everybody into this direction, even at an early age. The teachers will talk to their children. They are mandated to do this by the state. You must educate in the area of drugs. Unfortunately, they are not well trained themselves. So where do they go? To the same area that everyone else goes. Heroin, LSD, heroin, LSD. They don't say a thing about coffee or cigarettes or alcohol. So the education process should be revamped so that we don't say no, 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 no. We say you must not misuse any number of things in this world while you are at this age, that age, or another age. You see what I'm getting at?
Yes, I do, absolutely. What do you think of the principle of bringing drugs into the classroom, showing them to the children, saying, this is what heroin looks like?
Absolutely horrible. Absolutely
horrible. I don't think showing them a pill, I think a lot of them know what the pills look like. Heroin's a white powder. It has no effect on these. I mean, as such, I think the effect of, and what my experience, talking to some of these people, seeing another individual in a trip with LSD has been more dramatic to these people and been more teaching, meaningful to these people, and frightening to these people than actually the thing of talking. You can talk and talk and talk, and I think you turn them off. We had an episode last summer in the morgue. We brought in a young individual with a death from overdose. We brought in some medical students. Now they're juniors in medical school. And this is the first body they'd ever seen of a dead person from drugs.
How did they react?
Quite startling. Mm-hmm. They were quite amazed and shocked. And the remark was, oh, how young. Now, I don't know what they had in mind or what they thought. We gave them the age of the individual, which was 21. But these people have been trained in the basics. They've had their first 2 years of medical school, and we're in their third year of medical school, so they've had some experience around hospitals and seen it. But this is the first actual run-in with death from a drug.
Mm-hmm.
I think that we cannot take a tablet or a powder to school, and we should not, in fact, and say, this is a Benny, this is a blue devil, whatever you choose to call it. You must not do this. Don't do it, Johnny. Don't take it. That child is more keenly intelligent than we give them credit for usually. He remembers when he was 2.5 years old and able to walk, that his mother told him, "Johnny, don't you go out in the street. I don't want you to do that." But when Mother wasn't looking, Johnny did go out in the street. And nothing happened to Johnny. He may have even got some sort of a thrill by defying that parental authority at the moment, even at that young age. Now, he remembers this. So now when he's 9 or 10 or 11, his mother says, "Johnny, don't take this, don't take that."
Right.
But Johnny remembers his mother told him, "Don't do this, don't do that," 6 years ago, and he's still here. He has survived.
Now
So maybe Mother doesn't really know what she's saying.
another beautiful example of education in relation to drugs not
Yes.
working is cigarette smoking. I mean, we know the cause and effect relationship here. We know that it's correlated with lung cancer, and yet we go on and
And
we
the
smoke.
studio is strewed with ashtrays.
What would you advocate? What kind of corrective procedures in the schools would you like to see initiated?
Well, first of all, I think we must avoid teaching children at too early an age. If they are going to ask questions, we certainly are going to answer them. I would advocate that. But we can't take the 6 and 7 and 8-year-old children and do what is really going on, drawing their attention to the fact that heroin comes in a plastic baggie, it's injected into the arm, and if you use it, something bad is going to happen. We cannot do that. We've got to use the entire picture, that misuse of many compounds, many things, is harmful. You know, we can't say if you misuse heroin, you're going to die. If you misuse coffee, you're going to die. That's medically documented. The same applies to cigarettes, to alcohol, to aspirin. So let's use the whole package. Don't draw their attention to heroin. Don't draw their attention to LSD or some of the synthetically produced amphetamine-type compounds. Let's give them the whole thing. Then they can handle it much better.
And what about the effects on the body? Not necessarily after long-term usage, but the initial kind of effects. Could you go into that a little bit? What happens when you start?
I think that our
Dr.
medical
Creighton, would you
associate here certainly
Yes.
would be able to comment on that.
Well, the first use use these kids will get, or anybody will get, and I think the best example was a man in supervision got keyed up. He's got the boss on top of him, he's got his workers underneath him, and he's in the middle. So he goes to the doctor, and he's rightly put on tranquilizers. Fine, they're good. They're used in the manner in which they're supposed to be used. Now the child sees them, or the young adult sees this, and he gets uptight, or she gets uptight with school, the whole thing, so tries one of them. And sure, they work fine, they relax you. So if one's good, try them again. And then pretty soon they start dipping into various things. Then they'll try combinations. Now, the combinations we're starting to see, and I'm talking about fatalities of drugs, and this is the bad side of drugs, is the fatal side. The good side is the physiological side, or how they help people. So there's a good side. The bad side is the abuse. The abuse can lead to mental deterioration, physical deterioration, and death. Now, this has been pretty well documented. Most of the problems we have seen have been the death side of it. Mr. Regent has seen the calls from the hospital for the increases in the amount of overdose cases that are coming in, and they are remarkably increasing. We see them after they've gone beyond the point of treatment and died from the depression these drugs cause of the brain and the higher centers, respiratory distress, and invariably death. Now, the thing, and I spoke to Tom the other day about this, and my impression, both in the automobile fatalities and in the drug deaths in younger people, we're seeing combinations of drugs. We're seeing alcohol, and alcohol to a high degree in a lot of cases. We're also seeing the use of tranquilizers or sedatives. Now, they potentiate one another. What would be a fatal dose or a non-fatal dose of a tranquilizer combined with alcohol can be a fatal dose, and vice versa.
I think, excuse me, I think what we are trying to say here, well, we have obviously a built-in bias because of what we do and what we see. We have seen unnecessarily too many young people in that Erie County morgue from the ages of perhaps 11 to 28, in that age group. Too many. And I don't think that we can concede that these deaths were primarily due to deliberate overdose.
I agree with you there.
They were due to a lack of information, a lack of knowledge, when it should have been given to them. And every human life at that age or any other age is precious. And we have got to do something, or as much as we can, to prevent that. Let these people live, let them contribute something to the society, and we certainly, obviously, need contributions.
Do you think very often it's social conditions which lead to personal problems, which lead to addiction, and perhaps in the school drug education programs there could be courses on problem solving and this sort of related matter? Do you think this
my
would help
experience
at all?
has been at that age group, the ones that have the problems, if you try to get parental cooperation, these are the ones that you don't get the parental cooperation from. I mean, this has been pretty well accepted at the school age. As you have a problem with the school-age child or the teenager, and in school, the school people pick up something and ask for cooperation. And these are the parents generally that poo-poo it.
I was going to say that I personally don't think that we can put the finger on social problems as being the primary cause.
Not the primary, perhaps, but it's one of them, isn't it?
It may be, it certainly is one of them. But we are seeing in the last 10 years that drug overdose, the use of hard narcotics, cocaine, heroin, and so on, has no boundaries. It has no boundaries. We're not talking about the black people versus the white people versus the yellow people or anything of that kind. But we have addicts in every age group, in every race, with every financial background. And this is what is disturbing. Of course, it has been brought out that now that we have so many whiteys who got into heroin, finally we are trying to do something about it. We could have done it 20 years ago when most of the addicts in this country were confined to Harlem. But we didn't. They were confined in one place. But in the last 20 to 25 years, it has spread. And finally now, we're beginning to push. Fortunately, the number of addicts in this country is declining. That's now documented nationally, that we're finally over the top, and it's coming down. But the combinations of the mood elevators, the tranquilizers, the sedatives, and the analgesics, they're rapidly climbing, and people are not using just one at a time. I've got a headache, my wife is mad at me, and my stomach bothers me, okay? So I got to have an aspirin, I got to have something to elevate my mood. My wife is nagging, so I'll have a drink with it. So now I have 3 compounds, and all hell breaks loose. Because after you have the first drink, you may have the second and third, and then you don't know what you're doing. And you say, well, now I've got to sleep. But I can't, so I have to try something else. And you know what the end result is.
It's a treadmill.
Yes, it's a treadmill.
Governor Rockefeller has proposed a bill which is now up before the legislature, which would impose very severe penalties on both users and pushers. Would you like to talk about this for a few moments, discuss its feasibility? Dr. Creighton, what do you think of this bill?
Well, he proposes more than that in his bill. He proposes also to extend apparently treatment facilities. They're making studies of the various public health facilities to put these people in for treatment. The one thing that I feel about it, and this goes back to the capital punishment law, which we had here many years ago, when we had murders and capital punishment. It was very hard to get a jury to go along with the capital punishment or a severe punishment where a man would go up for life with absolutely no parole, nothing. In other words, a dead end. The big problem, you talk to district attorneys, and they're having a lot of problems with this problem, is what a jury will do. We can all say, oh fine, put him away and lock him up and this, but you still have the man who has to be convicted, and you have to pick 12 of his peers to say, okay, you're going away for the rest of your life. And from my experience, I'm not a lawyer, but from my experience with district attorneys, that the punishment is so severe or so drastic that it's hard to get a jury, it would be hard to get a jury to go along with this.
It's life, isn't it?
It is life, permanently.
Mm-hmm. For either a pusher or a user.
That's
right?
correct.
Yes. But is this a deterrent necessary? Do you think a heroin addict thinks in terms of deterrent? I mean, if he thought about a life of misery, he'd never take his first shot, would he?
No. First of all, we have to recognize that in the present penal code, we can put people to jail for life for possession or sale of 16 ounces of heroin, morphine, or cocaine. Granted, that is a large amount, but the penalty is there, 15 years to life. Now, how many times have you or anyone else read that the life penalty has been imposed?
Very
I
seldom.
doubt that you could, you can probably count them on the fingers of one hand.
Mm-hmm.
This is not going to deter the addicts. I'm afraid what it might do, in fact, is to really open up the channels of supply. In other words, because we don't want to get caught, we might have to go to jail for the rest of our life. We're going to pass that around among more people to make it more and more difficult for the law enforcement agencies to catch us.
Mm-hmm.
And the reason behind that, of course, is money. It's going to take money to distribute it and get it to the user. But it doesn't matter. If it costs more money, the price of heroin will go up, and the addict will still pay it. So I don't really think that the life penalty mandatory for all sales and possessions of hard drugs is going to work. In fact, will probably not even get through the New York legislature. However, part of that proposed legislation is calling for more courts, more judges, more personnel to deal with the cases which we presently have. And I think this is going to be effective in that the cases of the pusher will get into the courts rather than give him the opportunity to plead to a lesser crime just to get it off the docket. He will now have to go to a jury of his peers and face the music, as it were, take the punishment that is meted out. We don't have the judges, we don't have the courts, we don't have the jails now. This legislation perhaps will provide that.
Mm-hmm. But in any case, the big-time wholesaler, the wholesale distributor, he's not going to be the one that's going to get caught, is he? It's going to be the little guy, the addict pusher who'll be caught, and he'll be quickly replaced,
That's right,
as
sure.
you say.
There's 9
so
people.
who's going to benefit from this,
Well,
if it goes through?
who is going to benefit? I really don't know. Well, we're going to produce what I said I thought we might, as far as courts and judges is concerned. Mm-hmm. But facing a life sentence, I don't think is going to deter these people at all. There are 9 people ready to take their place because the almighty dollar is there to be made. And this, of course, is behind the whole business of drug distribution, sale, and use.
Well, let's hypothesize. Let's suppose it does go through. If it went through, would you be in favor of taking the addict out of the area of crime, putting him into the realm of medical treatment and legalizing heroin prescriptions, as was done in England? No. You don't think this works?
I don't think it's been successful in England.
No.
We have a program which is a stopgap. I don't think it's any panacea. Methadone.
Yes, what do you feel about the methadone maintenance program?
Methadone has been, I would say, a great help in its use, again in its abuse, it's causing problems. I mean, again, you have the drug, which has its good points, methadone. It's put some of these people back into being self-sustaining for their families and themselves, but it also has produced other problems of palming the methadone off and selling the methadone and buying heroin. I mean, it's again, we've got the good side and the bad side.
And you're also swapping one addiction for another.
One addiction for
You're
another,
swapping one addiction for another.
but a lesser addiction.
It is a lesser addiction. It's better than anything else that we have at the moment. And we've got to pour money into the availability of methadone at the moment for more addicts, and whatever new compounds are synthesized by the manufacturers who are working on this problem today. There's no question about that.
Well, the problem in the drug industry has been well realized, and they are working and trying.
Are there any other heroin antagonists being researched right now?
Oh yes.
Yes.
Oh yes. There is a what we would call a long-acting form of methadone, which goes under the name of alpha-methadol. In other words, you can be administered this compound once a day, and it may last you for 72 hours. It is still in the investigative stage, but it shows a great deal of promise so far in the animal studies that have been conducted.
Just very briefly, in conclusion, what sort of outlook do you see for the future in this field?
Well, the outlook, as I see it, is more help for the addicts, try and get them more education. And I think the education's got to be a practical type of education.
Mm-hmm.
I mean, the facing and letting some of these people see just what they're up against, not talking about it. As Tom said, not bringing a pill in and showing it to a child. I think
I am firmly convinced that the heroin problem is going to decrease and decrease sharply in the next couple of years. But I don't feel that that is true of the other drugs. We are still seeing 7-year-olds brought into hospital emergency rooms, victims of drug overdose, and this is not their first admission to the hospital. And this is the tragedy that faces us. And it looks like it is not going to decrease.
Thank you both very much, Dr. James Creighton, Mr. Thomas Regent.
Yeah.
Thank you
Thank
for
you.
being with us. We'll see you again next week. Good night from Woman.